Good morning and welcome to this week's version of VC Notes, which is a coffee talk. We've done this several times, and today I am delighted to have with me Dr. Justin Turner. He's the CEO at Turner Care here in Jackson and also the Chief Medical Officer for the Mississippi Department of Health. This is not his first visit to the medical center. He, in fact, did his residency here. I'll ask him in just a moment to give us a little bit about his background, but he's no stranger to the medical center. He did his residency here in internal medicine. Just out in the hall, we ran into some people that he knew while he was a resident and was a big hug and a kiss, warmly received. Lots of fond memories of him while he was here as a resident by many people. I've heard many stories. And in the last few months, he's been here on several other occasions. He came to visit and look at MedCom, had a tour of Children's and a number of things, and then also gave a presentation as part of the VC series of Grand Rounds. And so we're very happy to have him here sharing some thoughts. That particular session was about community engagement. We may touch on that a little bit in our conversation today, but glad to have you here. Thank you for coming to do this and coming to visit with us. And if we could just start out, just tell me a little bit about yourself. I shared earlier that our audience would be our students, our faculty, our staff, so many medical center family members, basically everybody with a UMC email address. And then we share this outside of the medical center with a few friends and constituents outside the medical center. So not all of them kind of know your story. You're a Mississippian. Tell us a little bit about your path and your background and how you got to where you are today.
Yes, ma'am. First and foremost, thank you so much for the opportunity to be able to be a part of your coffee talk. As stated, yes, I am a native Mississippian, diehard Mississippian. I was born in Natchez, but lived in Jefferson County and Fayette, Mississippi up until age 6. From there, we moved to Port Gibson, where I stayed there up until age 16. Then we moved to Vicksburg back in 96, and I finished high school there, Warren Central High School in 99. Left there and went to Jackson State for undergrad in Jackson. So as you can hear, I've lived in a lot of cities and towns in Southwest Mississippi, but all of those is definitely home because all of those were a part of my journey and why I'm here today. So I left Jackson State and went to Meharry Medical College in Nashville for medical school.
I'm not going to be mad that he didn't come here for med school, but we're gonna go on by that.
It helped me appreciate, what I missed out on when I left there, right?
There you go.
So came back to Mississippi. I was there in Nashville, Tennessee, having a great time, just trying to figure out where I was going to go to do the rest of my training. And as I shared in the lecture earlier on, I didn't have an option to come back to Mississippi. I had an obligation. When I thought about my grandparents who grew up and they didn't understand, some of the medications they were taking and didn't really understand their disease process. And they were so excited about their grandson becoming a doctor and me coming home doing Christmas trips and being able to sit down with them and go over medications and explain this and explain that and just how much it did their heart good to do so. So growing up in Mississippi was definitely a learning experience. And as I've been able to come back and be here to train, at University of Mississippi Medical Center, it really is a fine institution to not just learn how to be a great physician, but just how to be a great person, because we take care of the sickest of the sickest. I mean, this is truly a heroic place because you have patients who have so many different things that they're dealing with, and not just physically, but mentally, emotionally, spiritually. And it takes a special place to be able to understand the holistic approach that's needed to really be able to meet that patient where they are. So I'm just thrilled to be here and be a part of this conversation as we be the change that we need to see in our community.
Well, thank you. And you know what I'm hearing you say, just to take what you said and interpret it, what I'm hearing is it's the mission of the place.
Yes.
And by the place, I mean the state of Mississippi. We have a lot of needs here in this state. I love the way that you said that about it's just an obligation to come back and to help us be better here.
Yes, ma'am.
I think that we have lots of wonderful people in the state who moved here from somewhere else, and they are again, drawn to and called by that mission.
Yes.
But I have such appreciation for Mississippians who very well could go other places
Yes.
and use their talents in other places, and in so many cases have many opportunities to do so,
Yes.
but are pulled back here and kind of called back here and believe in giving back or just being part of the future of the state and helping us get to a better place, helping us be a better state. There is, I think, just such a love for this place that calls you and draws you and makes you want to fight the good fight. So you opened a private practice clinic, which in and of itself is kind of brave. You know, that is becoming, as time goes by, less common than it used to be. And as I understand it, you are a solo practitioner in the clinic. You're the only physician there.
Yes.
Do you have a nurse practitioner working with you?
I have a nurse practitioner now.
Okay.
Yes, ma'am.
So that in and of itself is a fairly brave venture. And then the opportunity to become part of the staff at the Department of Health. So
Yes.
kind of tell us about how that transition, how that happened.
Yes. So in 2011, I was finishing my residency at the University of Mississippi Medical Center. And
Still so young. You're still so young.
Yes, I do believe that I'm still young at 41, but time has really flown. And, you know, at the time I was just trying to figure out what I wanted to do. Matter of fact, before I finished, I was thinking about specializing. And I was trying to see, was there a particular field that, you know, drew my interest more than others. So I thought about endocrinology, I thought about, you know, nephrology and different things. And it turns out that I liked a little bit of all. And being that I was able to help and assist so many patients during my residency who had so many needs across so many different organ systems that really were very interrelated, I was like, if I only become a allergist, then I'm limiting my ability to help someone who really has some significant needs as it relates to diabetes, or vice versa. So I wanted to stay general. So I chose not to, you know, specialize, but go into private practice. And I did for a couple of years working with corporate medicine. And it was an awesome, great experience. But I also realized that there were some limitations without me being able to be on my own. And, you know, I truly believe that, you know, there's no one size that fits all as it relates to healthcare. But for the community that I feel passionate about serving, I knew they needed a special approach. And when I thought about it and had reflections, you know, the vision I saw, or the vision I was given, was to treat the whole person, realizing that health is more than just taking pills. When I visited my grandma back in Jefferson County, and I saw how much she didn't understand, because she would take her diabetes medication, but she would send me down to the supermarket store and get those Little Debbie honey buns, they're 35 cents. They have really gone up since then. They have really gone up. Get those honey buns, and we had to have either cornbread or roll with every meal. You know, and now that I know what I know now, you know, she just didn't know better. And the health literacy is such a huge factor in why we have these egregious health outcomes. So being able to really treat the whole person, and sometimes I have a patient at Turner Care that has had an elevated A1C that's been high for 3 consecutive visits, maybe over the course of 9 months, I can't approach her the same way I can someone who's been controlled. So if there's an education deficit, then I'm going to move that chart to the side and ask, hey, tell me, what do you think about when you hear the word carbohydrate? What does that mean to you? Do you understand the difference between a good carb and maybe a not so good carb? And a lot of times I was surprised at what I would find out, because I would ask them how they're eating. Doc, I'm eating better and I'm eating good. And then when I asked them to tell me what they had, oh yeah, I don't eat any carbs. You know, when I get my vegetables, I just do my rice and gravy. And I realized that rice is a carb. So being able to communicate with them in a way where they're not feeling attacked, where they're not feeling judged because they don't know, is a gift that I feel like I have and I've been able to implement in having my own practice. And when I tell you that we've seen people who come in with uncontrolled blood sugars, A1Cs 15 just within this past year had a man who had an A1C of 15, suggesting that his average blood sugar has been 300, 400s, and his follow visit, his A1C was less than 6.
Wow. That's a
In
success.
the course of 4 months. But first of all, he was not aware, because a lot of patients in Mississippi think like this: hey, because I feel fine, it must mean
Everything's
I
okay.
am fine. He didn't know. So we educated, we gave him the resources. He did have some medications that, believe it or not, were not insulin, but we have newer medications that work very well, as far as the GL, the glucogen-like peptide agonists, as well as the SGL2 inhibitors. Put him on those, and his blood sugars came down, and he's a success story.
And you know, that takes time, and that takes really getting to know your patients and having the time to spend to them to understand more than just are they getting their prescription filled or not. All those things, like you mentioned, lifestyle and eating habits and what they know and think and understand. That takes a lot of time.
Yeah, it takes time. And, I have no problem with the way the private practice group and the corporate medicine group was set up with. It just wasn't for me. So at my clinic, my new patients get at least 30 minutes, sometimes 45. It just depends. And believe it or not, I don't get a lot of pushback from the other patients, because they know that if Dr. Turner spent extra time with their particular patient in exam 1, then that patient needed that time. They know to come in and bring books and magazines and different things like that. But for the most part, it's truly been a blessing. And we only really kind of spoken about the physical, but the psychosocial and the patients who have uncontrolled blood sugars because they're emotional eating, because they don't realize the level of stress that they're dealing with. And until we're able to pull back the layers of that and really, get down to the core of something that they have normalized for so long, that they basically have normalized their dysfunction. Yeah.
So how do you see yourself taking those sort of individual success stories and scaling it kind of in a different way in your work with the Department of Health? And I've heard you tell the story, so I'm gonna
Sure.
hook you a little bit on this
Sure.
to get you to tell it, because I think it's just a special story of how you originally connected with Dr. Edney,
Yes.
and then how your relationships kind of developed into this opportunity with the health department.
Right. So you have your individual health when you're seeing patients at clinic, and it's one-on-one. At the health department, which I've been so honored to be invited to be a part of, becoming the chief medical officer for the Mississippi State Department of Health, that's population health. So
To scale that up.
at our initial phone call with Dr. Edney, we were discussing, the idea of me coming on. I'm like, hey, you want me to do what? So I was like, hey, I'm busy with Turner Care. We got 4,000 patients. I really don't need to take on any more new patients. I just hired a nurse practitioner. I really want to bring more on and try to get more resources in my clinic, partner with nonprofits and bring in a diabetic educator. I had a huge plan to try to figure out how to help more Mississippians, because I was frustrated that I couldn't take on more new patients, especially coming off COVID, where so many people were hearing about Turner Care and how we really, focus on meeting the patients where they are, right? So I wanted to be able to take on more, see more, and I couldn't. So I was looking for office space, and like I said, Dr. Edney reached out. So when he did, and I had time to reflect on it, I said, well, I can't technically take on new patients at Turner Care, but if I assume this role as chief medical officer, that's 2.9 million Mississippians that can become all of my patients, right? Now I can't individually touch all of them, but I can sit in a conference room and we can develop protocols and guidelines that we put in all of our 88 county health departments and empower our clinicians there to be able to touch those persons. So what we've done over the last several months, I've been invited to speak to our district meetings in the Southern District, Central Mission, and I go in there and I talk about the same thing I'm talking to you about. I talk about my story. I talk about the experiences at Turner Care. I talk about the importance of connecting, because I learned in COVID, woke up 3 o'clock in the morning one morning realizing that if you cannot connect, you cannot correct. And I don't care, how knowledgeable a clinician is and how much they're able to quote articles and different things like that. And I'm an advocate of research, I really, really am. But all of that goes over your patient's head if you're talking a language that they don't
That they are
understand.
not hearing and can't understand. And yeah.
So the level of buy-in that we're getting in these meetings and having our county administrators and the nurses and the nurse practitioners being engaged and excited about coming in and making sure that we know when we need to pivot here if someone is having challenges with being connected. And it's been amazing because they're on board, they're excited. We're coming up with new ways to be able to make sure that we are looking into those social determinants of health.
And I think during the pandemic, we learned a few lessons, or we learned a few things from the standpoint of, just like I've heard you say before, when we needed to get our vaccination rates up, particularly in our African American patients,
Yes.
we engaged the clergy
Yes.
and then engaged people at barbershops and other venues like that.
Yes.
Just like you said, meeting people where they are,
Yes.
having information coming from a trusted source
Yes.
so that you could make that connection.
Yes.
That was such a great way to see expertise being delivered
Yes.
and being multiplied by using relationships that are already there and that are already trusted and established. Just like you mentioned, you as an individual can't go out and see every single person in the state, but by using some of these other pathways as a vehicle, we were able, I say we, as a state, were able to get that message out to people and really changed the dynamics.
Dr. Woodward, yes, we learned so much from COVID, but
both good, bad, and otherwise,
good,
but
bad,
lots
and
of
otherwise.
good things. Yeah.
But some of us didn't need COVID to realize that there was a flaw in our design of our healthcare system. Now we appreciate COVID because it really brought it to limelight, right? But that relationship that you talked about is so important. And one of my spiritual mentors shared with me a couple of years ago. He said, Justin, relationship is a form of currency. And I never thought about it like that before, because relationships can do things for you that money can't. And we got a lot of money and resources during COVID, but it wasn't just the availability of testing, the availability of the vaccines, because we had those, but we had trouble with the uptake in the community. So it took those relationships to allow us to be able to get in the community, to help us realize that the community wasn't coming to us. So if the community is not coming to us and we want different results, we have to go to them.
So what do you see, whether it's from your experiences in your private practice or the COVID experiences, but as you think about the next few years, what do you sort of see on the horizon of, you're in this dual role, still kind of got a foot in both worlds. What do you see as sort of the next thing, particularly with the Department of Health role, or what you're hoping to accomplish, the next big thing you want to tackle?
Yes.
What do you kind of view on your horizon as the next big thing? Or it doesn't have to be one thing, but just the important goals that you have or objectives.
So I've learned in my limited time here on earth not to reinvent the wheel. So community engagement has been something I've been about my whole life before I even knew it was a thing. My grandparents taught us about service. I watched them sacrifice. I watched my grandfather not finish high school and sacrifice to make sure his children had an opportunity. I remember staying with him one summer and we were going to a youth camp at Alcorn for the summer. And I would be on the way out the door and it was time for my ride to come and get me. And he would always come out and he would empty his pocket. And I remember having lint in my hand one time with just some nickels and dimes. Now, he wasn't giving me a whole lot, but he gave me all that he had to give. And he taught me sacrifice, just the way he lived his life. So we did community activities even as a young child, as I watched my parents and aunts and uncles. So service is not what I do. Service is who I am. So being able to have the emergence of COVID and to have people that were not tourniquet patients to stop me in Kroger and say, hey, can you talk to me and my husband about the vaccine? Or people to stop and say, hey, can you tell me, why does it appear that blacks are not getting into something that we need to know? And for people to just trust me without directly knowing me based upon a relationship and a perception, reputation that I built up in the community beforehand. So my success with my influence was not based upon basically me coming out of the woodworks during COVID. It's because of the presence I'd
The
already had in the
work you had
community
been doing.
that I've been
Yeah,
doing
yeah.
since I was a child. So what I want to do with the health department is to help us do more community engagement. And we've done some, but we're not necessarily changing, but we're evolving because we need to utilize things like technology more. So I would like for us to brand more. A lot of the population that we need to serve, especially in the space of sexually transmitted infections. So right now we're dealing with the emergence of congenital syphilis. We are leading the nation right now. We've had a 900-fold increase over
Those are
the last
just
6 years.
staggering numbers.
It's staggering. I really feel like I'm in
numbers.
a bad dream.
Yeah.
You know,
And penicillin, I mean, it's not a mystery of how to
Right.
treat this.
Right.
It feels that it does feel like it can't be true.
it feel like it can't be true because with COVID, we were waiting on treatment, right?
That's right.
We was
that's
waiting
right.
to figure out, but it's treatment that's readily available, and for whatever reason, we're not utilizing the resources. So we know that it's more than one thing. So health literacy, that's part of it. So syphilis is one of those sexually transmitted infections where you may not have any symptoms. So that's part of the mindset. We have to really transition from a culture of illness to a culture of wellness and being proactive, right? So definitely focusing on more health literacy. But when I talked about branding and technology, utilizing social media. So taking non-traditional ways to be able to get information to the people. So most people are using their phone. So people right now, they love to go viral. And, being able to utilize TikTok and come up with videos where we can incorporate health education, I think it's going to be a game changer for Mississippi. And we'll do that all different health categories. I want to make sure that even with the technology that we're doing more telehealth. So we have certain counties in Mississippi where it's just hard for people to get to a place where there's adequate resources and providers. So one thing that Dr. Edney and I are doing is trying to incorporate telehealth with all of our different categories, family planning, with early intervention, with our Healthy Mom, Healthy Baby program. We're even looking into more transportation opportunities. So right now, we're trying to see about developing a relationship with like Lyft or Uber to be able to help get that mom to the doctor or be able to help with just figuring out whatever gaps there are with making sure that patients can get what they need as far as these social determinants of health.
I grew up in a very rural part of the state.
Gotcha.
So just from my own experiences growing up, from my own experiences for many, many years here, being a member of the faculty and working in the adult emergency room here, I think it surprises people when I talk to colleagues across the country that for some patients in Mississippi, transportation is still the first rate limiting factor that they have to overcome. So many times, like I said, my colleagues around the country are just surprised to hear that in today's modern time, there are patients that we have for whatever reason that just getting a ride is the first hurdle that they have. And they have many hurdles, but that is hurdle number one. So that is still something very real for us in this state. The access is a big problem, and it's a problem that has many different components. And one of those that you just don't necessarily think about is having transportation, having a ride is something to overcome. You mentioned social media, and I think that it's one of those things that's just not going away. I'm old enough to sometimes think back to the days before we had social media and to know the before and the after.
Yes, ma'am.
And there are pros and cons, and
it is.
There are definitely very good things about it, positive things about it, more than just keeping up with high school friends and seeing their pictures on Facebook, which is one of the kind of fun things.
Yes, ma'am.
But there are pros and cons, and there are ways that we can use it for education.
Yes.
But then we saw during COVID also one of the negative sides. Where the misinformation, the disinformation can take on a life of its own.
Yes.
So boy, that's a whole new challenge that we face in today's reality is how to use social media in such a way that it is a positive and helps us reach people, helps us educate people, because everybody, it feels like, whether even if they're in that category of a ride and transportation is a challenge, they still somehow manage to have a phone. It feels like everybody, perhaps
Yes.
at least unless it's our most geriatric population,
Yes.
they have a phone and they're connected in that way. So it is a real opportunity, but we've also seen some of the challenges that come with it, with the misinformation and the disinformation, and trying to channel it in such a way that it is a positive. But boy, that is it's a whole different body of
Right.
work that can feel all consuming at times.
Yes, you're exactly right. And, when people talk about Mississippi, especially when I travel to other places and they quote, some of the stats and how, things are bad here, things are not good here, I don't necessarily see it directly as adversity, but I see it as opportunity. So if we're in the worst in the nation with this and worst in the nation with that, we can't help but go up. So when you're at your bottom, you use that as a launching pad to spring forward because you can't go anywhere else. You can't go anywhere else about it, right? So I said that to say, we realize that in today's society, and, I'm old enough to remember when we didn't have it either, there's so much influence with media and music. There's so much influence with media and music. And it's almost as if it's not in media or if it's not on social media, then it doesn't have credibility. It doesn't exist, right? So let's be proactive and get ahead of this. This is an opportunity for us to reach people in ways that we hadn't done it before. Because
Try to use it in a positive
if people
way.
are not coming to the doctor, if people are not going to the health department website to read it, then we can. If we have a county in Mississippi that have high rates of gonorrhea, for example, we can take social media, we can do a sponsored ad for that particular geographical region zip code. And whether they want to or not, when they scroll on social media, it's going to come up. And we can
Try to push
drive
the
more
information
traffic
out there.
to our health departments, which can offer services at no cost to that mom or whoever that is, and help them with whatever they're dealing with. I would love for us to come up with an app for the health department website. Now, when I bring it up in certain meetings, and everybody's kind of looking like what? But why not?
Yeah.
Why not?
Yeah.
Apps are not going anywhere.
They're not.
So why not
They're
provide that as a resource? So let's say that we have a mom who has breast cancer, for example, and let's say that life happens to her. I have this sometimes with tourniquet patients. I have patients who have had private insurance for a while, and sometimes life happens, and I don't see them for probably about a year. And by the time I see them again, they say, okay, well, I lost my insurance, but you didn't lose me as a physician. So why didn't you communicate? Well, I didn't know you took people without insurance. Yeah, we have a discounted rate for that. So there's certain moms or certain people in general who get lost to follow-up, but if they have an app, there's a way that we can set up the parameters where we can always stay connected and we always know where they are. Even with the Maternal Mortality Review Committee that we have and looking at our maternal mortality, which is bad here in Mississippi, there are some moms who have died who we lost touch with. We went to their home, we called the numbers that we had, and we were not able to reach them. But maybe if we had an app where we can be able to be connected to them, yeah. My wife knows where I am right now. Life 360.
There you go.
I can't tell her I'm somewhere trying to surprise her to get a flower. Yeah.
All right, so we're going to wrap up in just a minute.
Okay.
But I know we've kind of wandered around and covered a lot of different things, but I did want to ask if there's anything in particular that you wanted to be sure to share with all the folks that might be listening and watching this that I haven't touched on. Is there anything that you, as you were thinking about this today, thought, I want to be sure I get a chance to say this or that or whatever it might be?
Yeah, so one word you mentioned early on is mission. And I want to speak on behalf of our state health officer, Dr. Edney, and myself, and know that we are here. This is not a job for us. We truly feel like it's a calling. We both come from private practice. He mentored me, and we are committed to doing everything we can to carry out our mission, which is to protect, advance, promote the safety and well-being of all Mississippians. We're thankful for our partnership with you all at University of Mississippi Medical Center. We're excited about our path going forward. We are here open-minded to do what needs to be done to help get us off the bottom. So Dr. Edney's theme is Change Can't Wait, and my theme is Better Together. And I think that we have a lot of talent, a lot of resources in Mississippi, but for whatever reason, we're not working as a cohesive unit enough. And as we've been doing that in areas that we have, even with our partnership, there's no limit to the success that we can have. So to anyone watching, please know that this is a new day at the Mississippi State Department of Health. Utilize us as a resource. If it's anything that we can help any of you all with as a partner, we want to be that. There's an African proverb that says, if you want to go fast, you go alone. But if you want to go far, you go together. We're here. We're ready. We're committed.
Thank you. Thank you. I appreciate that. And Dr. Edney is well known and loved here at the medical center. We feel like he's part of the medical center family. You're part of the medical center family. Dr. Dobbs, we've had a great relationship with the Department of Health for many years. Dr. Courier, Dr. Cobb. I mean, it just goes back. I don't want to date myself too much, but it goes back for a long time, and it's a very good partnership, and it is the sort of partnership where there is a shared mission and a shared goal to see us get off the bottom, just like you described, and to advance health and wellness for the citizens of Mississippi. So thank you for what you bring to the table, for the passion that you have and the commitment you have.
Yes, ma'am.
It is evident just in talking to you and visiting with you, the excitement that you have about this and the real commitment that you have. We appreciate that. Look forward to working with you in the future. Thank you for all that you did during COVID, and that, what we see on the horizon that's coming. I think it is good for Mississippi, and we're very pleased to have you in this role and to be working with you. So thank you for that. Thank you for being with us today. I know you've got a lot of things on your plate. I appreciate you sharing some time and some thoughts with all the folks here at the Medical Center family. So I'm going to wrap up and just say to everybody watching and listening again, thank you for all that you do. We've touched today a couple of times on the mission of the Medical Center, and it is so important, the work that we do here and the lives that we touch in many ways every day, and I thank you for that. The work happens where you are, with the patients that you touch, the students that you influence, the research that's going on. That is what makes the Medical Center strong, and what makes us really able to do the work we're doing and able to move the needle. So thank you so much for that.